The views, opinions, and discussions on the Pre-Hospital Pulse podcast are for informational and educational purposes only. They represent the perspectives of the host and the guest and do not necessarily reflect the official policy or position of any employer, agency, or regulatory body. This podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. The clinical concepts and debates presented are designed for trained EMS professionals to challenge dogma and explore the why behind the medicine. All listeners are responsible for adhering to their local protocols, scope of practice, and direct medical control. Always exercise your best clinical judgment in the care of your patients.
Attention all units, the air is being held for emergency traffic only.
This is the Pre-Hospital Pulse podcast. The podcast that delivers high-yield EMS education and real-world opinions you won't find in a textbook. We're here to dissect complex clinical concepts, challenge the dogma, and explore what it really means to think beyond the protocols. Hi, my name's Corey, and I'm going to be your host here on the Pre-Hospital Pulse podcast. Today's episode is just going to serve as a bit of an introduction and a quick overview of what we plan to cover here on the podcast. Before we dive into some of the specifics about what we will be covering here on this podcast, I'd like to give you a little bit of background about myself. I'm currently an EMS educator. I've been an EMS educator since somewhere in the ballpark of 2018, give or take a few months. Currently, I run the training department at an EMS service that has about 180 employees at any given time. As training department, we do our own in-house education for all initial education levels, from EMT to AEMT, and also for the paramedic level. We also provide all of the continuing education for our employees as well. And my role is to oversee that on a high level and also to run the field training officer program that we have at my service. So now that you know what I'm doing currently, here's a bit of background information about all of my experience in some different environments that I can bring together to help improve myself as an educator. Started out in EMS in 2009 for a small rural service as an EMT. While doing that, I went to college for 4 years and obtained a bachelor's degree in health science with a concentration in human health. Pretty soon after that, I started the paramedic program. That lasted about a year. Finished up the paramedic program, started working as a paramedic. After a while working as a paramedic, I was promoted to field training officer, which made me responsible for training new employees as well as serving as a primary preceptor for any EMS students that came through our program. After being a paramedic for a couple of years, I got an opportunity to take over and run the training division for a small county-based EMS service where at that point I really learned how to start being an educator. During my time at that program, I learned a lot. And then at one point before I left that program to pursue a opportunity in flight medicine, I actually served several months as interim director. And my time as an interim director began just before COVID started. So I got to see all the operations and government dealings related to COVID policies and things of that nature during my time as the director. Then I spent about 3.5 years flying full time. During that time, worked a couple different hospital-based flight programs with very progressive protocols and freedom to really make decisions. Now, what I learned primarily from working in these flight services was that flight clinicians don't inherently have an exceptional skill level that not every field person has available to them. But what a flight clinician possesses that a lot of other EMS personnel may not have had the opportunity or may not have been pushed to develop is the ability to think critically in a situation. Most of the patients that we're getting are a little bit higher acuity on average than your patients that you're transporting in a ground EMS service, because the ground EMS service providers didn't typically call a flight service for their routine everyday patient. The patients we were getting were kind of that top 10% of the sickest or the most injured patient populations out of that group. So I learned very quickly that it wasn't that I was having to do skills that were different or that were harder or anything like that. What I really had to do was I had to think critically and efficiently on how to come up with a care plan for this patient. That really brings me to the point of this podcast. And the point of this podcast is going to be to dive into ways to improve critical thinking beyond what your protocols may say in writing. Now, what that doesn't mean is it doesn't give you the freedom to go outside of your protocols, but you have to think outside of just the bullet points that are listed on paper or outside of the flowcharts. While the protocols serve as an excellent guideline for you, they don't necessarily cover everything that you could possibly ever come in contact with. So think about it for a second. How many patients have you ever came in contact with where they didn't exactly fit one of the algorithms that was outlined in your protocols? Or they didn't necessarily fit just one of your protocols. They may have had components of 2 or 3 different areas in your protocols, and you had to figure out what to do for that patient. Well, how do you do that? To do that, we have to employ critical thinking skills, and we have to look at our patient and we have to do an excellent assessment and take all of the information that we gather in that assessment, and we have to turn that into a treatment plan for that particular patient by taking bits and pieces from the protocols that are related to that patient's injury or illness or their complaint and weave those together to give that patient the best possible care for their current condition. So with that being said, our primary goal here at the Pre-Hospital Pulse podcast is to talk about how we can improve our critical thinking abilities. Who is this podcast going to be for? Well, this podcast can be for any EMS provider or potentially even someone who's not currently in EMS and who's just interested in looking into becoming an EMS provider at some time in the future. As an EMS educator, I can offer tips for improving scenarios and delivery of content in the classroom. With several years' experience as a provider in multiple different areas of EMS, from ground EMS to flight, and even some emergency management experience, share with you some of the ways that I've learned how to perform specific things or how to improve my assessments so that I get the information that I need to make a good clinical decision for my patient. Again, if you're an EMS student, then these are some things that you can be applying to your thought process early on in your EMS career so that you're not having to go back and relearn or redevelop your decision-making process later on when you realize, oh, maybe I've just been following the protocols blindly and not really looking at how I apply those to individual patient situations. So at the end of the day, I hope you can take away a little bit from this podcast and be able to apply something you learn here or a thought process that you learn here to your practice so that you can provide better care for your patients. So with all that being said, I hope that you can take something away from this that you can use to improve your practice, either as a field provider, as an educator, or even as a student. Or maybe this can be something that helps make your decision on whether or not EMS is the field that you want to get into. At the end of the day, the most important piece of any EMS clinician's career is being able to use critical thinking to make high quality decisions to provide the level of care and the kind of care that the patient needs in their particular situation at the time that the EMS provider is caring for them. And without the ability to think critically, that is something that you're just not going to be able to do effectively. I think EMS as a whole has done a poor job of teaching critical thinking skills and other skills of the same nature to new clinicians. So I'm hoping that with this podcast, that could be something that we can change together moving forward. So, as I said at the beginning, this is not going to be a long episode. This is just a little bit of an introduction to the podcast and some of what you can expect in the future from our podcast. As you can see, I don't have a super fancy studio or a lot of ridiculous equipment to work with, but what I do have is several years of experience in multiple different environments that I bring to the table to be able to have an educated discussion with you on different topics and to hopefully let you see the EMS practice in a different light and help guide your ability to make that crucial time-sensitive decision in the moment and do that effectively so your patient gets the best care possible. Thank you for listening in, and hope you come back to listen to our first real episode in about a week. Until next time, be safe out there and do your best for the patient.